So how to use antibody testing to prevent or reduce outbreak disease in a shelter. And this is one of the most exciting things we've been doing over about the last 5 years now. And in cooperation with my colleagues like Dr. Sandra Newberry and others, we have actually gone in to shelters in the face of a distemper outbreak. We did one just recently where we cleared that outbreak up very quickly by doing antibody titers. We have an outbreak that I just heard about this afternoon of panleukopenia in a shelter where we're going to go in and do antibody titers. How do antibody titers help us there? Well, using these on-site tests, we can go into that group of animals that are part of the outbreak, and by doing the test, we know whether that animal is protected or not. We can also test animals that are coming into the shelter, and we know if they don't have an antibody titer, we don't want to put them into the shelter. For example, one of the safest places to send them would be to a foster home if you can. I know many shelters don't have true isolation, but if you can put them in an area somewhat removed from the site where the outbreak is occurring, that would help until that animal has a chance to develop an immune response to the vaccination that should occur immediately. But those animals that actually have antibody, we can put those in right in the face of the outbreak, and they are protected. And we have, as I said, been doing this for 4 to 5 years now, and it works very well. Most of the outbreaks that we deal with are distemper or parvo in the dog, and of course parvo in the cat. So they're the ones that we have the ability to use antibody testing to really save lives. And in the past, when large numbers of those dogs were euthanized because they didn't know whether they're susceptible or not, or whether they were infected or not, we don't have to do that now. We have ways of determining which animals are likely to be protected and which aren't. So I think that that's a critical take-home message, and that's, of course, why we titled this particular presentation, Antibody Titers Can Save Lives. So the animal shelter testing, antibody test results would indicate a negative or low incoming animal should be placed in an isolation if available, as I've just said, or in a foster home preferably, not even in that particular site. The positive or high incoming animal can be admitted to the shelter without concern about them developing that disease or requiring special facilities. And we've seen this over and over again. Now, is that to say that there isn't one animal that might have an antibody titer that might get sick? That is possible, but it's going to be a rare occasion that that occurs. We haven't seen it very often, but I can tell you that some dogs, for example, that are already infected with distemper, just before they develop very severe disease and die, they will have an antibody titer. Those would be, when we test them, considered protected, but they're not protected, they're already infected. If we combine the antibody with a detection method for the pathogen, but we're getting into too much cost, then we would know that that particular animal was not protected and was infected. Negative or low animals already in the shelter and exposed are at risk, so if possible they should be placed in an isolation area. They should not be adopted until an appropriate holding period. Now here's something that's critically important. For canine parvo or panleukopenia, that holding period should be at least 2 weeks. For distemper, it should be at least 6 weeks, because that's the incubation period. And unfortunately, those who are reading the old literature about distemper, that 2-week incubation period does not hold for distemper in 2000. In fact, it didn't even in 1980 or 1990, but it surely doesn't now. So you have to hold a distemper suspect for at least 6 weeks before you can really declare that animal not infected. So that's critically important. And in some of these outbreaks, they were following the old 2-week. They were sending them out, and the dogs, after adoption, came down with encephalitis and died and so forth. And that's not something that anybody wants. So you do have a much longer holding period for distemper than you do for parvo. Shelter outbreak testing, antibody testing has worked, and it will work for distemper, parvo, and panleukopenia. For outbreaks of canine infectious respiratory disease complex or feline infectious respiratory disease complex, antibody titers are of no value whatsoever. They provide us no benefit, mainly because local mucosal antibody, herpes virus antibody not playing a key role in protection. It just doesn't work with everything. But the most important outbreaks, really, it does work with distemper, parvo of canine and feline.